US President-elect Joe Biden and his wife are set to be vaccinated against the coronavirus. The move comes after 2 potential contacts tested positive. Mr. Biden's inoculation follows US approval for a second vaccine for emergency use. Now, Simon Marks joins us live from Washington, D.C. for more on this. Simon, after Mr. Biden, will the rest of the incoming administration also get their jabs early?
Well, they will eventually get their jabs, but there's no indication that that's going to happen at any time immediately. At the moment, Joe Biden is getting the vaccine because of the position that he occupies in the order of succession here, and also because of the imminence of his transition to the presidency. And in the case of his wife, Jill Biden, she, of course, will become First Lady of the United States. But the Biden campaign is spending quite a lot of time weighing up the risks to Joe Biden and Kamala Harris of contracting COVID-19 now that there have been fresh cases closer to their immediate orbit than they had previously experienced. And there are reports here that consideration is being given to having substantial numbers of White House staff with the incoming administration not working at the White House, at least initially, but working from remote locations. You know, that White House there behind me looks very big when you see it on television, but actually it's very small and very cramped. And the Biden team are worried that one of the reasons why it spread so rapidly through the Trump upper echelons is because of those cramped quarters. So they're giving thought now to the idea of splitting the personnel up and having key members of staff located at the White House after the inauguration on January the 20th, but other members of staff located off-site.
Simon, what about reports of a debate? I mean, even now, over who in the general population should get vaccinated first? You'd think essential workers, the elderly, but it's a bit more complicated than that.
Yeah, it is more complicated than that for a couple of different reasons, Ateli. I mean, first of all, this is not a national policy. As we've said on the programme before, the US national government, certainly under President Trump, has been not spearheading the creation of that kind of a plan. It's fallen to each of America's individual 50 states and territories like Washington, D.C. and Puerto Rico to determine their order of priorities. Broadly speaking, it's going first to first responders and frontline healthcare workers and the long-term residents of care homes. But after that, the order in which people will receive the vaccine varies by the state. In some states, they're prioritising minority communities that have shown a greater susceptibility to COVID-19 because of comorbidities than some other members of the population. But these are decisions that are falling to the individual states. Now, Joe Biden's team has indicated that they think it may be late summer or even the beginning of next autumn here. That would be sort of August, September of next year, before the general population in substantial numbers is receiving the vaccine and creating the herd immunity that the vaccine will convey, which indicates we're in for many months of conversation, planning and rollout. This is not going to happen anytime rapidly, even as COVID-19 deaths and hospitalizations continue to tick up here in an absolutely tragic way.
All right, thanks for getting us up to speed. Simon Marks there, speaking to us from Washington, D.C.